Hi guys, welcome back to a sit down. So this video is about getting to know me and mostly about a clinical associate, because a lot of people keep on asking me anytime I say I'm a clinical associate graduate. Everybody keeps asking me, what is a clinical associate? What do you guys do? And I think I did shoot this video 2 years back, and when I deleted my account I ended up deleting the videos as well. So anyways, for people who don't know clinical associate, this is what the video is all about, and also getting to know a little bit about me. So my name is Piwe, Siwa Piwe. I'm 25 years old. I'm currently doing third year pharmacy at Rose University in Grahamstown in the Eastern Cape. I'm a clinical associate graduate. I finished my matric in 2016. I was doing my matric in 2016, and then in 2017 I went to varsity at Walter Sisulu University. I applied for medicine, but because of the competition I couldn't get in, and they told us there is this course called Bachelor of Medicine in Clinical Practice, which is almost similar to what medicine is about, and in the work field you're gonna do what doctors do. So if you still don't like it, you can still apply for medicine after you finish your degree. So I was like, oh, okay, this sounds interesting. I've never heard about it before, but I'm gonna apply. Okay, I didn't apply for it, they just transferred me to it. So I did the course 2017. I was doing my first year. It's a 3-year course. On my first year we were doing mostly it was more about human biology, which, so basically in the first year of clinical associate it was just mostly about studying the anatomy and physiology of the human body and the non-pharmacological management of diseases. We had practical sessions which involved like history taking and measuring blood pressures. I don't even remember a lot, but it's mostly about the procedures that you do in the emergency department. And in the second year we went deeper into the pathophysiology and non-pharmacological management of the diseases, and we also had some practicals based on what we would do in the hospital environment and in the emergency department. And then in third year we went more on the divided sections. We focused on the child health, women's health, and psychiatric. And yeah, also we had some elective. We had to choose. I chose trauma and emergency for elective. So it was basically about that. And then in the workplace you basically consult patients, and like you take history. A patient will come, hi, I am so and so, I have headache or I have a tummy ache. You basically like write all that down and ask about the severity of the headache. You're trying to make diagnosis. You have to examine the patient, and if you can't find a diagnosis based on the examination, you have to take bloods, send them to the lab, tell the patient to come back when the results are ready, interpret the results, and then prescribe medication for the patient. While the patient is gone without the results, you do prescribe empirical treatment just in the meantime while you're waiting for results. So that's what clinical associates basically do, and most people will confuse it with medical doctors in the hospital, because that's basically what doctors do. But I'll tell you the difference. The difference is that for clinical associate, under our scope of practice, it's supposed to be, all these things are supposed to be done under the supervision of a medical doctor. It could be directly or indirectly. Could be like indirectly, as in telephonically. Directly, there must be a doctor in the hospital you're working at. Not that now, like they won't sit next to you when you're consulting a patient, but there must be a doctor in the hospital that you can always refer to. That's the kind of supervision I'm talking about. So yeah, that's what clinical associates do. And also another thing that clinical associates don't do is surgeries. We only assist in certain surgeries, but we do not perform the surgeries ourselves. The only procedures that we do that will require getting into the human body will be suturing a wound that is broken. We do suture, and then we do also insert ICDs for people with pneumothorax, hemothorax. We do insert intercostal drain. We do pap smears. We do a lot of other non-invasive procedures, and we do pleural tap as well for diagnostic purposes and for therapeutic purposes as well. So that's what clinical associates do. And I worked for 2 years as a clinical associate, and on my second year of working I got pregnant. And when I was pregnant, I kind of didn't have it easy in my workplace, and a lot of people were asking me when am I going back to school, and my mom included. It was more like when you're a clinical associate, people don't respect you, and people still think you still need to go and study something else because it is not, I don't know. They will have to respond for themselves. So it was that kind of thing that you feel like maybe what you're doing is not good enough. You get undermined, you have to explain yourself every day, who you are, what you do. So it was kind of stressful, but more than anything, the salary wasn't great. As much as you could afford to buy yourself a car and some nice little cozy house, but to be honest, you wouldn't like, it was not the kind of lifestyle I wanted for myself. And after buying a car, I bought a car when I was like about 6 months pregnant, around July 2021, and around that time, that's when I realized, which I don't have money. All my money was going towards the car, and I was like, I'm about to bring life. How am I gonna provide for this baby if all my money is going towards a car? And at that time, I'd already applied for pharmacy, and around October or November, I think it was October, I received an email from Rhodes University saying I've been accepted for pharmacy. And guess what? I already had a car that is new. I only paid for it for like 3 months, and I had a baby coming. What am I gonna do? Am I gonna go to school? Took me some time to decide what I was gonna do, but I accepted the offer in the meantime. And then I'm actually rushing because I'm about to go pick Melanie up. So this Q&A is quite rushed. I'm sorry about that. If I do miss anything that you want to know about, please comment, put it in the comment section. I stay next to the road, so there are cars moving. Okay, so after I've delivered Mila, I took a decision that I was gonna go back to school. And my mom was behind me 100%, and my baby's dad at that time was willing to help with the baby, so that kind of gave me the courage to continue with the studying. And I was on maternity leave. Luckily, I gave birth in December, and my maternity was supposed to start in January, so I went to school while I was on maternity leave. For the first 4 months of studying, I was actually getting paid, and I actually resigned end of May, and I got my resignation money in July. So it made my first year of studying very easy, and then I passed. And then last year I was doing my second year of studying, and yeah, it's been great. And that's all for today. And on my next video, I'm going to be talking about pharmacy. So why pharmacy? What is pharmacy all about? What do pharmacists really do? I'm in third year now, and I feel like I kind of get what pharmacy is about now, because like compared to when I came here in first year, I had no clue. I was just doing it so that I would get out of being a clinical associate. So for my next video, I'm going to be talking about pharmacy. What do pharmacists do? Why is pharmacy important? Why should you consider studying pharmacy? So thank you guys for watching. See you on the next video.